Hi guys, in today's video we'll be talking about APGAR score. As soon as the baby is born, the general condition of the baby is being assessed by this APGAR score. It was invented by Dr. Virginia APGAR in 1953. So the assessment is done 1 minute at birth and 5 minutes later. It can be defined as the clinical assessment of the baby's condition measured in numerical terms at 1 minute after birth and 5 minutes later. The first 1 minute now is important for further management of resuscitation. Immediately the child is born, you check everything. You check if the baby is breathing, you check the activity, the muscle tone, you check everything to know if this baby needs resuscitation. It stands for activity, or it can also be known as muscle tone. P stands for pulse, or you can call it heart rate. G stands for grimace or response to stimulus. A stands for appearance or color. R stands for respiration or breathing. So the essence of this thing now is for me to break down this thing so that you can use this one now to explain, to know what this one is in case you forget this one, but there's no way you can forget it because it's just like acronym. You use the woman's name to form this thing. A score of 0, 1, 2 is awarded to each sign in accordance with the guidance of the table. Assessing the baby, you either give the baby 0, 1 or 2 according to this table now. So the first one is activity. If a baby is born and you find that the baby has no muscle tone, the baby is limp, no movement of the limb, no of the hand, the baby is not stretching the body, as per crying. And when crying, you see a baby stretching his or her hand and the leg, no muscle tone, and the baby is limp, you give 0. If there is some flexion of the limb, small muscle tone, you give the baby 1. If the baby is active, very very active, hyperactive, just give the baby 2. So in pause, if the pause is absent, maybe if you check the apical pause and the pause is absent, you give the baby 0. If it's less than 100, you give the baby 1. If it's more than 100, you give the baby 2. Okay. In grimace now, grimace is response to stimulus. If you pinch the baby, that's why they used to beat baby. When they are born, you beat them, make them cry so that their lungs, we open. So if you beat the baby and the baby did not cry, did not do anything, you give the baby 0. If there is minimal grimace, there's response to stimulus. Maybe the baby now do somehow, cry small, you give the baby 1. If the baby cry very well or cough or sneeze, you give the baby 2. The appearance now, if the baby is blue, like it signifies cyanosis. If the baby is blue or pale, you give the baby 0. If the body is pink, while the extremities, the hands and the legs are blue, there is cyanosis in the extremities, you give 1. If the baby is completely pink, you give 2. So respiration now, if you check the respiration and it is absent, you give 0. If it's slow and irregular, you give 1. If it's good, if the baby is crying, a baby that is crying signifies that the lungs has open, the fetal circulation has closed, while the adult circulation now takes place. So after calculating everything now, if the total of this thing now is 8 to 10, you know that it is good. If it's 5 to 7, you know that this baby has mild asphyxia, so you have to do a little bit resuscitation here. But if it is 0 to 4, severe asphyxia, run and resuscitate this baby before another thing. So this baby now that has this APGAR score needs expert management, urgent intervention. So in this APGAR score, you will see something like 8 in 1 and 10 in 5. So this is the one that they did at birth and the one that they did 5 minutes later. So this is the end of our today's topic. See you in my next video. Have you subscribed to my YouTube channel? Everything nursing by Nurse Chi. Everything nursing by Nurse Chi. Subscribe to my YouTube channel.